and Assalamualaikum. We are Group 4 from SAP, and in this video, we're going to be presenting about malaria, a preventable yet a deadly disease. So, to provide an overview, what is actually malaria? Malaria is a life-threatening disease that is caused by the bites of the parasite through the bites of infected females Anopheles mosquitoes. And malaria is commonly found in tropical countries such as Africa and also Southeast Asia. Next, I am going to talk about the chronology of malaria in Malaysia. So according to the Ministry of Health of Malaysia, the history of malaria went way back during the 1960s when there were 240,000 cases that were recorded across the country, and most of the cases are recorded from Sabah and Sarawak. But these cases has decreased tremendously, fortunately, due to the implementation of effective strategies of the government.
My name is Iman Hardi bin ROSLI and I'm from Group 4. So, what causes malaria? Malaria are caused by Plasmodium parasites that are transmitted through the bite of an infected female Anopheles mosquitoes. Another way of this disease can be transmitted is through blood transfusions. So, if a person receives blood transfusion from an infected donor, so the Plasmodium parasites will enter the bloodstream. One of the contributing factors of this disease is stagnant water. Most of the mosquitoes are likely to breed in stagnant water such as pots, ponds, puddles, and etc. These areas will increase their population and their survival rates.
Moving on to the symptoms of malaria. Malaria has a lot of common symptoms and it usually starts with fever. So this fever can be cyclical or intermittent. Alongside the fever, the person that has been infected with malaria will also experience chills and intense shiverings alongside episodes of severity as the fever subsides. Other early common symptoms of malaria include headache, muscle ache, fatigue, and also weakness. Malaria can cause nausea and vomiting that can lead to loss of appetite. If malaria is left untreated, it will progress to a more dangerous stage, also known as severe malaria. Severe malaria can cause cerebral malaria. It occurs when the infected red blood cell blocks the blood vessels in the brain. This will cause seizures, confusion, and even loss of consciousness. Severe malaria is also related well with severe anemia due to the destruction of the red blood cells. Another symptoms of severe malaria include respiratory problems such as difficulty in breathing. Other concerning symptoms of severe malaria include organ dysfunction such as kidney failure and even liver failure that can lead to jaundice where the eyes and skin turns yellow.
Fortunately, it can be treated effectively if diagnosed early. The main treatment for malaria is anti-malaria drugs, with ACT, artemisinin-based combination therapy, being the most effective. It combines 2 or more drugs to kill the parasites quickly. Chloroquine is another treatment, but it is only used for specific malaria types. For severe malaria cases, intravenous artesunate is administered directly into the bloodstream for faster action, while quinine with doxycycline or clindamycin can be an alternative when ACT is unavailable. In addition to anti-malaria drugs, supportive care is important. Patients may require fluid therapy to prevent dehydration, fever-reducing medications like paracetamol, and blood transfusions in cases of severe anemia. Some types of malaria, such as Plasmodium vivax and Plasmodium ovale, can relapse because the parasite remains in the liver. To prevent this, a drug called primequine is used to eliminate these hidden parasites. In summary, malaria can be effectively treated with the right medication and supportive care. Early diagnosis and proper treatment are key to recovery.
My name is AQILAH with ZAKI. You should also take precautions to avoid mosquito bite. To lower your chances of getting malaria, you should apply mosquito repellent that contain 20 to 35% of diethyl toluene to exposed skin. Second, you should put mosquito net over your beds. Third, you should put screens on windows and doors. Fourth, you should wear long sleeves and long pants to cover your skin. And fifth, you should spray pyrethrin in your bedroom before going to bed. Lastly, there are 2 vaccines that protect against malaria. Public health officials recommend vaccination for children who live in areas where infections are common. That's all from Quiz Group 4 S18. I hope you enjoyed our presentation about malaria disease, and thank you for listening.